All right, good morning, everyone. Here we go. Today, we're going to finish up with cardiac emergencies. I'll teach about CPR. And tomorrow, we'll springboard into doing the hands-on testing of CPR. Okay? So our objective today is to be able to describe the importance of the cardiac chain of survival. And I know we looked at it yesterday. Does anybody remember those 4 steps I gave you for the cardiac chain of survival? Because it's in your notes from yesterday, in your breathing emergencies and CPR packet. Does anybody remember that?
Cardiac and breathing.
I don't know. Does anybody remember what those 4? Go ahead.
Early 911.
Early 911.
Early CPR.
Early CPR.
Early AED.
Early AED.
And early EMS.
And early EMS or EMTs. Okay, pretty critical. We watched that funny video yesterday about The Office, which I love showing. Today, this is a little bit more serious, this video. Okay, your last reminder is tomorrow your fee is due. It's $19. And the yellow group. If you are in the yellow group, your current event is due tomorrow. So please make sure you take care of that.
I'm Rich Fellner.
We watched it.
Did we get to this one?
Yeah.
I thought we just started this.
My name is Cherie Brackett.
Were they talking about having a heart
My name
attack?
is Thomas Beasley.
Yeah, we already watched it.
First symptom was severe indigestion, which was not fixed by an antacid.
First thing was the chest pain. I noticed that almost immediately.
I had a question.
It was very uncomfortable. Felt like somebody was standing on my chest.
Seemed like it was getting tighter, like a fist was in there, and it was like something was just crushing it.
Then came profuse sweating just out of nowhere.
Pain radiated right up into my jaw, and then down into my arm and fingertips.
And all of a sudden, you can't breathe, and you start sweating, and your chest started hurting. Something's wrong.
Then a sense of doom that the whole world was coming to an end.
I was very scared. I decided that it was time to tell my wife. It was time to go to the hospital and, see if it was in fact what I feared, which was a heart attack.
I told my wife, I had never felt this way, and I was serious when I told her this too. I said, it's time to go. She probably looked at my face and said, he's not playing.
Sweating, he was sweating, and things that he never did before that made me know something was wrong.
It's important to know what to do when someone that you love becomes pale or sweaty and has chest pains.
It can happen to anybody, and it can happen overnight. It can happen in the blink of an eye. I'm just very glad to be here telling the story, and that I knew what to look for.
Sometimes I get a little emotional when I talk about it. Usually a tear drop out my eye. This was real serious.
So I immediately got help. I went to someone at the front of the store and asked them to call 911 for me. And within 15 minutes, I was in the hospital emergency room being treated for a heart attack.
Because it can happen at any time and anywhere, and you just don't know when it's going to happen.
I'm glad to be here today.
He's my beat. He's my beat. And I love him. I love him a lot.
The reason I think it's important to show you guys that video right there is because although the one lady appears to be a little bit older, probably in her early 60s, that man there and the other guy, the white guy and the black guy, they're not very old people. One of the questions that was asked of me in period 1 was, can a teenager have cardiac arrest, have a heart attack? Yeah, absolutely. Now, is it rare? Sure, it's rare. It's rare, absolutely, but it can happen, and it does happen. I mean, normally if a teenager has a heart condition, they've had it since they were really young, and they have treatment, and they know how to handle it, and they're on a special diet, and they can do certain exercises that are okay for them to do, and there's some stuff they can't do. Some have heart conditions, and they can go ahead and live a full, normal life, but it can happen. I mean, and you just don't know when it's going to happen. And that's the other piece that I want to make you understand. Okay? Now let's take a look at a scenario or a scene here from the American Red Cross where it's actually them responding with the
Cardiac
cardiac chain
emergencies
of
are
survival.
life-threatening. Heart attack and cardiac arrest are major causes of illness and death in the United States. Following the cardiac chain of survival by recognizing the signals of a cardiac emergency, calling 911 or the local emergency number and giving immediate care saves lives. Performing CPR and using an automated external defibrillator or AED immediately after a person goes into cardiac arrest can greatly increase his or her chance of survival.
Oh, Jada. Sandra, help. It's Jada. Jada? Tony, bring me my bag, please. Jada, can you hear me? Jada? Alright, looks like she's unconscious. Call 911.
There are 4 links in the cardiac chain of survival.
Yeah,
How do
Donna.
you know if it's like a heart attack or if she's like dehydrated?
Well, let's think about, oh, you weren't here for it. It's okay, because you're gonna make it up tomorrow, most likely. When the person goes down like that, we're responding instantly by checking them. Are you okay? If they don't respond, we call 911, especially with an adult. Okay? The next thing we do is look, listen, and feel for 10 seconds. We lean the head back, we put our ear close to their mouth, we listen, we feel for any breathing, we look at the chest rising and falling. If you're not getting anything, that means their heart is stopped, most likely. And that's when you make the decision, hey, I need to kick into CPR, exactly. Now, if you've got something going on there, a little bit of breathing, shallow breathing, you can't do CPR. So that's a good question. The other piece of it is, in terms of what you can do when they're unconscious like that and breathing, nothing. You still should send for 911. You know, call 911, get me an ambulance here so that they can actually figure out what happened to that person. If you go back to what I was talking about yesterday when we talked about cardiac emergencies, it could be a medical thing. It could be their medicine. They forgot to take the medicine. They could be diabetic. They could have some other kind of medical condition that they weren't caring for that led that to happen. So that's a good question.
That guide any response to a cardiac emergency. Early recognition and access to the emergency medical services system, early CPR, early defibrillation, and early advanced medical care. The first link in the cardiac chain of survival is early recognition and access to the EMS system. Recognizing a cardiac emergency and activating the emergency medical services system gets help on the way quickly. Early CPR is the second link in the cardiac chain of survival. Performing CPR keeps blood containing oxygen flowing to the brain and other vital organs. The third link in the cardiac chain of survival is early defibrillation. Early defibrillation from an automated external defibrillator, commonly called an AED, may help to establish an effective heart rhythm and significantly increase the patient's chance for survival. Early advanced medical care is the fourth link in the cardiac chain of survival. Professional responders can provide the knowledge, equipment, and medications to continue the life-saving care you have already given. In a cardiac emergency, when every second counts, responding quickly using the 4 links in the cardiac chain of survival can mean the difference between life and death.
Understand, and I'll probably repeat myself on this, that with those AEDs, they all sound the same, or excuse me, they all can sound a little different, but they all do the same thing. They're all programmed to do the same thing. And that's pretty crucial for you to recognize, no matter what you're trained with, because I have basic trainers over here. If you had to go and grab one down the hall by Ms. Rossiter's office, it's still going to do the same thing. It's going to talk you through everything the same way one of these trainers would. If you're out at work and there's an AED there and something happens, again, the same basic principle, okay? All right, this is a pretty good video. This is about a guy who is probably early 60s, and he's playing basketball with some friends, and he collapses.
Life can be taken away in a split second. Just ask Tony Gilliard, who suffered a heart attack in the middle of a basketball game at Fairview Baptist Church.
I got a rebound, and you'll see this, and I got a rebound, and I come down here, and then people started picking up on defense, and I go past, and I go up, I make a layup, I jog back up to the foul line, and I'm holding on to my shorts. I slap hands with somebody and holding my shorts like this. And I sit down on a chair that ain't there. And 10 minutes later, I see the lights in the sea.
Because of the quick response by players on the court, Gilliard is here today. Josh Thomas, along with another player, administered life-saving CPR and used an AED to get Gilliard's heart to beat again.
I've been a first responder for 2 years, and this was the first time I'd ever, thankfully, had to use it. So I mean, I guess afterwards you start to think about what if, but you can't really do that. And I can't say enough to the group of guys over here that night were just incredible. So, it's amazing.
Rita Gilliard, Tony's wife, thinks this all happened for a reason and wants to spread the word about life-saving AED.
It's hard to see your husband die on the basketball court, but knowing the outcome, it's a relief to know what the defibrillator, it works. But to watch him, and that's the reason I told her today, watching your husband die on the basketball court, it makes you want to get the word out.
Okay, so having somebody there that knows what they're doing, that's pretty crucial. You know, that's a lifesaver. I have a friend who this actually happened to him over at Shady Grove Middle School. He was playing some basketball with some guys in their early 50s, and the one guy collapsed, and somebody who was there knew exactly what they were doing. They ran and got the AED, and actually saved the guy's life. So again, that's something that can happen at any point in time. You guys knowing how to save somebody's life is pretty crucial, because you don't know when it could happen. And you don't want it to happen at home and you not know what to do besides make a phone call. All right. In your packets, top page 4. In the new packet. We're done with the old packet. You can put the before giving care packet away. You'll just need to do a review in there when you take the test for that. At the top of page 4 in your new packet, the definition of CPR. It's a combo of chest compressions and rescue breaths. They take the place of your lungs and heart because your lungs and heart aren't working. It's exactly what they do. And by doing that, by you knowing how to administer that CPR, essentially you can save somebody's life, or at least give them a chance at having their life saved. The next question down says, to be certain an unconscious person needs CPR. I want you to follow what rule? It's the check, call, care rule. Okay, something I taught you since like day number 3, after we did all the other administrative stuff. This was like one of the first things I ever talked about. Check the scene, check the person. There's no response. Have somebody call 911. Don't you be the one to do that if there are other people there, simply because you can be giving care ASAP to somebody, because every second counts. Once you've got that person calling 911, that's when you make the determination if the person needs CPR by look, listening, feeling for 10 seconds. If you get nothing, if there's no breath on your face, if there's no sound coming out of their mouth, if you don't see the chest going up or down, then you get right into your CPR. For adults, we go immediately into chest compressions. The cycle will always be the same: 30 chest compressions and 2 rescue breaths. Always.
If you want to put your mouth on it.
Well, if you had a mask, you know, you're okay. Now, the thing is, if you don't have a mask, it's a stranger, you're uncomfortable with it, you can give continuous chest compressions. You can do that. You were taught that last year in health, so you can do that. remember, if you miss anything, you can always pull these notes up off our Google Classroom, and you can pull the video feed too. How are we doing? Can I move forward? Ivan, you good? Jacqueline? You good? Okay, I don't want to go too fast right now. All right, so let's take a look at CPR for an adult, and then I'm going to stop it at adult, because I'm going to teach child after we get tested out of adult. I don't want to put too much on your plate today. So. You have shields. I gave you shields. It's in your kit.
Knowing how to correctly perform CPR will help you provide care to a person having a cardiac emergency until another trained responder or EMS personnel take over. First, you will learn how to give effective CPR compressions. Then we'll add giving rescue breaths. Finally, we will practice some cycles of CPR. This video is designed so you can practice the skill while you watch it. However, your instructor may ask you to practice the skill after watching the video. If so, watch closely. You'll practice soon. Now get ready to practice CPR. Position yourself next to the mannequin with your gloves on and your CPR breathing barrier ready. First, place the heel of one hand in the center of the chest along the breastbone. Then, place the other hand on top and lace your fingers together.
Okay, so when you're putting your hands together to give a compression to somebody, you're going to go right above the sternum. If you feel right here, there's a bone right here. It's called your sternum. You're going to put your hand on its side with the palm, the bony part of your hand, right in there, and you're going to interlock your fingers so that they look like this. You literally, the top hand should be pulling back so that the bone of your hand, essentially at the bottom there, is what's doing the work. Okay? That's going to be pretty important. Now, in your notes, I want you to put these things. When you give a compression to an adult, you go down about 2.5 inches. Okay? Somewhere in your notes, there should be some space for you. I can leave some space. In a child, you want to go down about 2 inches. And in an infant, we want to go down about 1.5 inches. Okay? 1.5 inches into an infant. How do we know that we're going down far enough? Well, technically you don't. You don't have a measuring stick that you can put beside you. Yeah, it looks like I'm about 2.5 inches into them. Now, on our mannequins, when we're doing the cleaning and care for them, you notice that plate, and you notice when you press down, 2 little green lights will come on right here in the shoulder if you've done it correctly. Well, that means you're going down about 2.5 inches. But in a real life situation, that's not going to happen. We don't have green lights on our shoulders. Okay? You will. You'll get a sense of it. You'll get a sense of it. You definitely will get a sense of it. Hopefully our EMT friend will come in and speak to us, and one of the things he'll talk about, because this is always a question that comes up. When you're giving CPR to somebody, do you break ribs? There is a chance that that's going to happen. You know, depending on the person, you know, if it's a senior, you know, sometimes senior citizens are brittle. If it's a small child, it can happen. You know, it can happen. You shouldn't be fearful of it, though. First of all, if you're following all the guidelines of the Good Samaritan law, and the person's life is saved, they can come back and say, I'm suing you for breaking my ribs. They can't do that. All right? Second of all, this person's dying. Hello? I think they'd rather have broken ribs and live than not live. Would you guys agree with that? All right, the next thing I want you to get down right now before I continue with the video is this. When you're giving compressions to somebody, you should be able to get about 100 compressions per minute. About 100 compressions per minute. It is a lot, Dara, and here's the deal. I don't expect you to sit down tomorrow and test out a CPR and be able to do that. I don't. You've never done it before. You've got a little taste of it in health, but you've never really done it. But once you get to the end point of all the stuff I'm going to teach you, you're going to find that 100 compressions is really not that much if you're using the correct technique. You can get through it in no time. Okay? Now these things I'm giving you, I am guaranteeing you are going to be on the exam. So hopefully you wrote these down. Guaranteeing them. The third thing I want you to get down before we get back to the video is this. It doesn't matter if it's an adult, a child, or an infant. You do 30 compressions and 2 rescue breaths when you do 1 cycle of CPR. 30 compressions and 2 rescue breaths. We also teach still in my class, responding to emergencies, that when we are checking and need to start care, we give compressions to an adult first, because most likely it's a cardiac emergency. And with a child under the age of 12, or a smaller child that you can identify, or an infant, we give rescue breaths first. Because normally we say it's a breathing emergency that has led to a cardiac emergency. Does that make sense to you guys? Yeah. So with an adult, we'll start with compressions. Once we get into CPR, and with a child and infant, we'll go right to rescue breathing. Okay? So we can start back with the video.
Position your shoulders directly over your hands. Keep your arms as straight as possible and your fingers up and off the chest.
If you don't want to get tired when you're giving compressions,
It's on the back.
you'll roll, yeah, exactly. You're exactly right. You'll roll your shoulders forward, and I'll demonstrate this. Forward shoulders mean that you're using your lower body and your back to give the compressions, and your arms are just kind of like, I always said it's like, you hold a hammer, and the hammer's the tool, which is what your arms would be, but your arm is what's doing the work, and that's what your back and lower body would be doing.
Push hard and fast in the middle of the chest, at least 2 inches deep. Now, give 30 chest compressions. Try to keep an even pace. The compression should be at a rate of at least 100 per minute. Counting out loud can help you. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11.
Each compression should be smooth. Let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Okay? Stop. Give another full set of 30 compressions. Remember, keep an even pace. The recommended rate is at least 100 compressions per minute. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29.
Okay. Stop. CPR is performed in cycles of 30 chest compressions and 2 rescue breaths. To give rescue breaths, use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the mouth. Blow in for about 1 second. Watch for the chest to rise and fall with each breath. If the chest does not rise, re-tilt the head and try another rescue breath.
Okay, write this down for me, please. Rescue breaths are done in 3-second cycles. 1 in and 2 off. And the way I always do it is 2, 3, 2, 3. So a rescue breath is done in a cycle of 3 seconds. If you blow too hard into somebody when you're giving a rescue breath, it messes with their gastrointestinal tract. Guess what can happen?
Boom. Blow up.
Yep, they'll throw up all over you. Yep, even if they're unconscious and not breathing, it can happen. So you blow into them firm for 1 second.
Your instructor will pause the video and help you practice giving rescue breaths.
We're going
Now
to practice
practice
tomorrow.
doing cycles of 30 chest compressions, followed by 2 rescue breaths. Get into position. Place your hands on the center of the chest, fingers laced and up. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Some good breaths.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, and 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9, 30.
Always rather.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13.
Okay, stop.
Having to do that. No.
Your instructor will pause the video to give you some feedback. When we begin again,
I want you to pay special attention to the prompts they give for this person. What time's the bell ring? 24? Yeah, we'll get through this video and this will be it for the day. Tomorrow I'll actually do a hands-on instruction, hands-on demo for you, and we'll try it and then test out of it.
now let's simulate a real response. From checking the scene to checking an unconscious person and through a few cycles of CPR. Stand a few steps away from your mannequin. Your gloves should be on, and you should have a CPR breathing barrier ready to go. On my cue, check the scene for safety, then check the unconscious person. You will be given only the information necessary to make a decision about what to do next. Ready? Go. The scene is safe.
Are you okay? Are you okay?
There is no response.
Call 911, this person's unconscious.
1,000, 2,1,000, 3,1,000, 4,1,000, 5,1,000, 6,1,000, 7,1,000, 8,1,000.
There is no breathing.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Glad I have my pocket shield. Look at that ready.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30.
You should be able to get 5 cycles in 2 minutes.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12 and 13.
Do not stop CPR except in one of these situations. You notice an obvious sign of life. An automated external defibrillator, or AED, is ready to use. Another trained responder or EMS personnel take over. You are too exhausted to continue, or the scene becomes unsafe.
Okay, the reason I don't have you write those down is because you wrote those down at the very beginning of the semester, and I don't need you to repeat them. I'll refer back to them when we go to do review for the exam. Tomorrow when we come in, I'll review this information, we'll review the steps so that you can record them, and then we'll get right after you trying it a little bit and then testing out of it. Any questions?